Pelvic floor 101, don't do that. When you squeeze mom butt is...
You're gonna be like touching people.
Where is this going?
Okay, what about my pelvic floor?
Yeah. Body cable knit leotard.
Hello everyone, my name is Caroline. Welcome to Pregnancy as Critical Thinker podcast. Today we're joined by Dr. Krista, who's a pelvic floor specialist here in Austin. And hello, Krista.
Hello, so happy to be here.
So glad you're here. So we'll just have a couple of questions about pelvic floor. It's such an interesting subject to have. And I'm a specialist who's a specialist in pregnancy and postpartum. I was fascinated to hear what you have to say. And I know you work a lot with moms too. So we're going to chat about that and just hear your story. And let's actually begin with that. Tell us a little bit about yourself.
Sure. So how I got into pelvic health, I majored nutrition at UT Austin, and my advisor was like, you do not want to be a dietitian. You're going to be in the hospital watching knife fights. So I was like, okay, what else can I do? I didn't want to be a dentist or an eye doctor or any of those other things. I wanted to do something health and wellness related. So I was like, oh, I'm sure you can specialize in women's health within physical therapy. So I went to Texas Women's University. Our first semester, we had like 5 different professionals from the community come in and talk about the different aspects of pelvic floor physical therapy. And I was like, yep, I can do that.
What was it, like the first rotation? I mean, the first introduction to...
It was just like some introductory coursework where they like talk about the different areas you can get into, because there's so many different areas of physical therapy and different niches. So yeah, I went my first semester. I was like, yep, I'm going to set up all my own contracts. So I set them up. I mean, if you don't set up your own contracts, you just kind of go wherever they place you. You won't even know where you go. So.
Wait, what do you mean by setting up your own contract? What does it mean?
Like when we have our, I guess if you want to call it your residency or rotation, where you basically go and work as a student in a clinic.
Okay, like almost like an internship in a way? Yeah, okay.
Yeah, kind of like a medical residency, I guess,
Yep.
but for physical therapy. And they're like 3 months long. So yeah, some of my classmates got placed horrible places that they hated because they didn't set up their own contracts.
In pelvic floor specialty?
No, just in physical therapy in general.
Therapy.
I mean, there really aren't any in pelvic floor unless you go set up your own new contracts.
Really?
Yeah.
Wait, why? Is it because it's not as common?
It's just very niche, yeah.
Okay.
Yeah. I mean, the field is pretty new. I mean, it's really blossomed within the last 10 years. So.
Yeah, actually, I did want to talk with you about it because I remember back when I lived in New York, I also worked with pregnant women, so prenatal massage and postnatal massage. But back then, I remember one of my clients told me, like, oh, like, I'm going to a pelvic floor therapist. I'm like, who is that? Like, what in the world? Like, so she was, like, the only one, where now I see my clients that, like, probably, like, 1 and 2 people, like, tell me, like, yeah, go to pelvic floor physical therapist. So that's amazing, and I'm glad it's happening. But do you know what caused kind of the rise of, like, I'm just curious, like, what caused the rise in curiosity in the pelvic floor field?
Well, I mean, just so many people talk about these conditions. And I mean, with women's movements all around the world, I think people are like, okay, we do not need to deal with all this stuff. Like, enough. I mean, slowly growing, people hear word of mouth that people have been able to heal these conditions. I mean, scar pain, pain with sex, leaking urine, leaking stool, having, painful pelvic exams, whatever
so,
the
like,
things are.
Before it was kind of just like, told us like, oh, that's just how your body works.
Yeah,
pretty
that
much,
happened to your grandma. It's going to happen to you. It's like leakage and pelvic pressure prolapse, like, are things that maybe we can't heal your prolapse, but a lot of people can become symptom-free from gaining better pressure management and being able to control their muscles better, having better awareness. I mean, so many people are unaware of that area of their body.
For sure. That's actually such an interesting topic as well, that you're not aware of your pelvic floor, because most of the people don't even know where it is.
No, they don't even know there's muscles down there.
Exactly.
So, like, what is that?
To me, I remember it was really interesting, where I was learning about, obviously, anatomy and how all the structures connected, because with massage, like shoulder could be like, connected to your hip, like such a crazy...
Yeah, the fascial lines.
Exactly, fascial trains, it's incredible. But I remember when I learned that you have your back, your core, and everyone's like so focused on a strong core, you have your diaphragm and your pelvic floor. And all 4 create this pressure
the core canister. Like a soda can.
Exactly. So if all the people like, oh, you should really, really work on your core. And I feel like a lot of my clients have very strong core, but then their back with their pelvic floor is weaker, and they still have like all the disbalances. And
well, if you're only engaging from your abdominals and not the deep pelvic floor too, that's just pressure going down out the pelvic floor, and could contribute to more pelvic pressure incontinence type symptoms as well. Because you need the pelvic floor to turn on with the core. If just the abdominals are turning on, that's, if you think of the pressure can, it's squeezing in the center and pushing out the bottom.
Oh.
Like if, I don't know, you have like a squishy ball. If you squish in the center, it's going to squish out the bottom, right?
So wait, so it's supposed to be activating together when you do like ab exercises and
Yeah,
stuff?
I mean, ideally the pelvic floor should subconsciously turn on with any ab exercise. Sometimes with trauma, pregnancy, postpartum, we can lose that automatic contraction, and we have to think about it until we regain that subconscious awareness or that subconscious engagement. But yeah, ideally the transversus abdominis, that deep core muscle, and the pelvic floor muscle should always turn on at the same time. Yeah.
Wow. Okay, that's I did not know that.
Yeah.
How do glutes play into that? Because I know there are a lot of glutes usually kind of also dismissed as like a postural main player. So like how they connected?
Yeah, well, especially during pregnancy, a lot of times we get the mom butt.
Yeah, exactly.
Because we kind of get into that external rotated state where we're kind of like that pigeon walking, toes are out. So when we're constantly in the external rotation, our deep hip external rotators, like the piriformis and the obturator internus, some of those deeper muscles, they start to get turned on and they kind of overcompensate for the glutes.
Yes.
So yes, the reason we get the mom butt is because those deep external rotators take over. The piriformis, the obturator internus, we call them, the deep hip external rotators. The glutes are also an external rotator, but they're more superficial. So sometimes cueing to like engage the inner thighs, basically when you're doing a squat or deadlift, can help get you out of that external rotation and help the glutes fire. Also, so many fitness people are telling you to squeeze your butt at the top of exercises like squats, lunges. I think like number one thing, pelvic floor 101, don't do that. When you squeeze your butt at the top, you're getting into that external rotation and forcing those deep hip external rotators to turn on. Your glutes are a hip extensor, so they are going to engage when you squat, bend, to stand, no matter what. So you do not need to squeeze your butt at the top.
All right, that's a controversial opinion. I love it. Wait, so why do they tell you to squeeze? I think it's like because it's wait, I try to
I think it's turning on your muscles more, I guess,
but it's makes
making you turn on different muscles.
Yeah. The ones, especially moms, probably don't need to turn on because it's already kind of hyperactive and yeah. Wow, that's really cool. We're gonna definitely highlight that. And on that actually sense, I have noticed that I myself clench my butt when I work. Yeah. So I'm leaning over people, over table, and I know a lot of moms do it as well because like their core is a little weaker.
Oh yeah, like they're compensating for a weak core.
Yes, and I heard that can make, and I guess that makes sense, that they can make your pelvic floor weaker if you clench your butt kind of all the time.
You're using that instead of that. I mean, one of my homeworks for everyone is throughout the day, make sure you're not clenching your butt or your pelvic floor. I mean, your pelvic floor should turn on when you need it, turn off when you don't need it. So you should not just be clenching your pelvic floor all the time.
How do I know if I'm clenching my pelvic floor?
So that's one of the main things we work on is gaining that awareness and that kind of neuromotor re-ed of first week, kind of like you have trigger points in your neck or shoulders or anywhere else in your body. You can get those in your pelvic floor muscles.
Absolutely.
So first, we're doing that soft tissue manipulation to try and get those muscles back down to their normal resting tone. We should be able to contract, relax, and then kind of bulge down, like if you're having a bowel movement or birthing your baby. So a lot of times people get stuck in this half-engaged position. And if you think like a bicep curl, if you're only squeezing this much, you're not as strong as if you're engaging that whole 100%, range.
Yeah.
So some people, think leakage is only because of lax or weak muscles, where your muscles might be tight, and a tight muscle can be weak because they don't have their functional range of motion. Just think, if your pelvic floor is here and you're trying to stop the flow of urine, you really don't have a strong contraction versus if you have that big, strong engagement.
Yeah.
Where was this going? What did you ask?
I'm just fascinated about. I told you that I've noticed that I'm clenching my butt and I'm like thinking like, oh, it's probably gonna lead me to have weaker pelvic floor, and I've been trying to do massage without clenching my butt. It's hard because I'm leaning over, and I feel like my abs get tired, and I'm just like, I'm gonna turn off at this point.
But also like with things like running, you should not be thinking of squeezing your pelvic floor this entire time. Your pelvic floor should subconsciously engage like a trampoline. So with every jump, run, whatever you're doing, you shouldn't have to think about it engaging. It should just be turning on, turning off by itself, because it does have that subconscious role, not like other muscles. It has more of that mind-body connection to the pelvic floor where it should function. And we shouldn't have to think about really it in daily life. It should just be there, and we should be able to go about our daily day, our day-to-day.
I guess that also can be applied to like core and back muscles, right? Because if we are balanced and everything turned the way it should be, we shouldn't be thinking about it. Like we do move like proper body mechanics.
But I mean,
this should be kind of like a habit.
Sometimes if you're like lifting something super heavy though, like you're gonna want to exhale with exertion and like do your pelvic floor brace or pelvic brace, I like to call it, before you lift something super heavy. But typically, like a normal person that isn't having pelvic floor issues, like you should not think of engaging your pelvic floor with each rep of an exercise. Exhaling on exertion is good because as we inhale, pelvic floor relax, kind of we blow up like a balloon, everything's lax. As we exhale, pelvic floor naturally slightly engages.
So it's kind of like a diaphragm.
Yeah.
Okay.
Yeah.
Interesting.
The pelvic diaphragm, yeah.
Is it actually you called it? Okay, nice. In your circles of pelvic therapists. So wait, so if we do inhale, right, with the diaphragm, it goes down?
And pelvic floor goes down. They both go down at the same time, both go up at the same time.
That's interesting.
That's why it's best to exhale on exertion. So before lifting your baby, before pushing, pulling, coughing, laughing, sneezing, like exhale with it.
I feel like it's so
I know so
intuitive.
many people are super confused.
Yeah, exhale when you try. Yeah, because I feel like when you try to do something that require some effort, you're like, and then you actually stop breathing, which I think is the worst thing you can do.
Which is more like the Valsalva. Yeah.
With what?
Valsalva, like when you're holding your breath. I mean, for like certain strength.
That's the name of when you're holding your breath. So many new words I'm finding out with you.
Or like for like one rep max type things. I mean, some super big strength athletes it's good to do the Valsalva because that's the only way they can keep their core strength while lifting super heavy weights. But I mean, day-to-day normal people, we don't really need to do the Valsalva. That's when you hold your breath, but you also engage pelvic floor while you're doing it.
Because I think a lot of I noticed that a lot of my clients who like in the third trimester-ish, because the joints are already a little funky, loose. They, for example, when they go to the bathroom at 3 a.m., they hold their breath and then they sit down, and a lot of times they kind of injure and tweak something in their back. I don't know if you noticed anything like that with the breathing per se. So like, I don't know, a lot of my moms just like. And then they do something, and it just causes...
they didn't do that pelvic brace before lifting, or it didn't happen like it should subconsciously.
Yeah. So it just causes a bunch of injuries. Don't do that. Amazing. So tell me then, we're talking about this awareness, and I guess how does a normal... So you say like normal person is supposed to have like intuitively, just how body's supposed to operate. Our body
just works. Yeah, like you breathe. You don't think about breathing. You just breathe.
Yeah, true. But I feel like so many of us don't have that awareness, like mind-body connection in general, but awareness. And I feel like a lot of people do have issue with pelvic floor. Is that true? Yeah. Okay, they do. Okay. So what point of time, like for example, you're a young person, have no care in the world. Yeah. At what point of time you're supposed to stop and think like, okay, what about my pelvic floor? Yeah. What is going on with it?
Well, I mean, a lot of people that were dancers or gymnasts have a lot of issues because they're chronic core sucker inners. And that creates a lot of tension in the pelvic floor if you're like constantly clenching or spasming those muscles. Yeah. That can, or bodybuilders.
So if you're a dancer, if you're a bodybuilder, go now, right?
Probably. Well, you know that a lot of college age athletes have incontinence, like a lot of gymnasts and I mean runners and
So kind of like after they finish their career, they start having
during their career. Yeah, like gymnasts will be doing their flips and they have to wear pads in their leotards. Yeah.
Why is it not addressed? Is it just kind of sacrifice in order to have that
well, I guess, they don't know better to know that they can find someone to help them with their pressure management. I mean, as a pelvic floor PT, a lot of it is pressure management. So if you're doing these jumps and rows and you don't have that pelvic floor endurance or that, that strength, then it can lead to issues, or marathon runners that are like peeing their pants towards the end type thing.
That sounds weird because I feel like they have so many specialists, like, if you're like a high-end
and a lot of their coaches are just like, oh, here's, we were talking about the LV trainer before, or just like, oh, here's this LV trainer. When it's like, well, that issue might not be because they just have pelvic floor weakness. They probably have bad pressure management overall. Whereas like the serratus anterior muscle, the one that kind of projects your shoulder blades forwards, that muscle also helps expand your rib cage through the back to help breathe through your back. So sometimes when we're only breathing out through the front, that's so much more pressure out your abdomen and down your pelvic floor. That can contribute to symptoms of having bad pressure management, like leakage or pelvic pressure prolapse symptoms.
So when you diagnose someone, you actually look at things like serratus anterior and things like
Their
that.
Breathing, being able to breathe through your back. Also, if we're always in a kind of like tilted back rib cage, rib flare, then that can play a big role too. We want the ribs stacked over the pelvis. But we also don't want to be slouched over because that's kind of like a tube of toothpaste, right? If you're rolled up, that's more pressure down too.
Yeah.
So if we're super tilted up or super tilted down, that we want that core canister, we want to be stacked and have that canister as well. Which, I mean, the perfect posture is the next posture. So we're not saying that like, but I mean, posture does have a role. I mean, some people are like, oh, don't ever worry about posture. But for pressure management.
Who says that? Oh my God, cancel them right now.
There are some physical therapists out there that are like, oh, posture doesn't matter. Next posture is the best posture is the next posture. Like, don't worry about your posture. Just don't stay in prolonged positions. But I mean, like, as a pelvic rehab provider, I mean, the stack of the rib cage over the pelvis and like that pressure management of your core canister is really important.
But I remember when I was in med school, like that's like the number one thing they told us, like the pressure in your abdominal cavity is what keeps your organs in place. Yeah. And if your organs are in place, there's less chance they're not going to function properly. So when someone says, don't worry about your posture, that kind of, I would think twice going to them again. Wow, that's incredible. All right, I hope we can move as a society to understand that a posture is number one thing you have to care about.
Which I get is like sitting is bad, but also standing for a long time is bad too. Like you need to switch it up. So I guess that's where it's coming from.
Yeah, I mean, I understandably so. Like if you sit for 16 hours, if you stand for 16 hours, neither are good. Yeah. It's like with anything in life, you have to find a balance. Probably if you chain smoke, but if you probably smoking is not the best. Okay, example. Maybe they drink coffee. If you drink 16 cups a day or one, they still say like 1 cup of coffee a day is good for your nervous system. So
I think it's good for.
I drink it. I like it. Yeah. Cool. So then we figured, I guess if you're a gymnast or a ballerina or dancer, a bodybuilder, you have to take care of it pretty much from the beginning. But if you're a regular person who just goes to school and, again, just starts thinking about their health, like what age maybe they should start?
Well, I mean, if you're having symptoms, so say you're constipated, our stool should be shape and consistency of a ripe banana. So if your stool is little pellets, that's definitely...
I never heard that example before. Okay.
Definitely an issue. I mean, we should be able to pass bowel movements pretty easily and not have to, I mean, you do have to kind of bear down a little bit. Your core can engage, and it's good to exhale, like as you're having your bowel movement, try not to have that Valsalva where you hold your breath. So if you struggle with bowel movements, if your bowel movements aren't soft and smooth and easy to pass, if you have pain inserting tampons or menstrual cups, that can be signs of pelvic floor tension, leakage of any kind.
Pain during sex, all these.
I mean, people with prolapse or pelvic pressure symptoms usually have worse symptoms at the end of the day after prolonged standing, feels like a tampon's kind of falling out type sensations.
Interesting. Yeah. Okay. So if you have any of the symptoms, you should probably go to and check your pelvic floor.
And also sometimes say you've gone to a physical therapist for back or hip pain in the past and it hasn't been resolved, pelvic floor could be the driver that's causing that. Oh, because your pelvic floor helps stabilize all those joints. So that's why it's so important to have a strong pelvic floor, especially during pregnancy, postpartum, because you need to stabilize with all that laxity. So sometimes just learning how to do your pelvic brace, and you have to think about it at first, but eventually it becomes subconscious. So that way when you're lifting up things, I mean, especially if your pain is with more transitional movements, learning how to do that engagement correctly when you're doing things. But majority of people do not know how to do a pelvic floor contraction correctly.
Exactly. I feel like I might be one of them. Sometimes I like pay attention to it, but I feel like especially when you're like busy with something, it just like all goes to shit.
But also for people who have leaking with impact activities like running or jumping, it could be coming from the ankle or the hip, but the shock absorption. So say you don't have eccentric control, which is like that slowly lowering into like letting your arch lower or through the hip, letting it internally rotate. That can put a lot more pressure on the pelvic floor to have to work harder than it needs to.
Oh, wow.
Yeah. So we're looking at the whole chain.
Yeah. that's like downside of like working on your posture in general of the body. It's like everything's so connected. It's insane. It's like the coolest thing and also the hardest thing. Right. Okay, cool. Well, let's see. I did want to ask you, just like kind of reroute from what we're talking about. You do home visits, like I do, but I mean, obviously you're a pelvic floor therapist, so it's a little more intimate than what I do, obviously. So tell me, I'm just like curious myself, like how does it look? Do people get weird? Have you had any crazy stories there? Like,
I love doing home visits. I think it's super important, especially postpartum, because I'm like, you really shouldn't be leaving your house for like 3 weeks anyway. And also just having to bring your kids with you to an appointment or have someone watch them. Like they can be there. You can breastfeed during our session, whatever you need to do. I also like to see like what their home environment looks like. Do you have the equipment you need to be able to do exercises I want to show you? Or do you have time to do this? Or where would you do this? Is it even feasible? That kind of thing. But no, I feel like, I mean, people are usually super grateful to have the option.
Yeah.
And yeah, I don't have any super crazy stories yet. Luckily. Do you?
Actually, no, unfortunately not. I really don't.
Unfortunately.
I mean, it would be great for content, but I like literally all my clients are amazing. I feel like, I don't know, just Austin in general, such a good vibes here. I feel like in New York, I might have like some crazy stories, but I didn't do home visits there. Yeah. But yeah, no, in Austin, I feel like everyone's pretty chill and kind of I noticed, I don't know if you, have you lived anywhere before? I forget.
I'm from Boston area. Originally.
Boston. Oh, okay. So East Coast, you know the drill. But when I moved to Austin, I noticed that all people kind of in general are more about like holistic health and like going to different appointments and trying like different therapies. And I think that's incredible. And it's definitely a good field for us. I mean, good place for us. Yeah, exactly. Well, cool. Okay. I was just curious, like if people get weirded out or something, because I think sometimes like my clients,
I mean, I do have to I do a lot of explaining before we do anything just to make sure they know what's going on.
You just lay down, I'll take care of everything.
Which, I mean, it's not like an OB appointment. Like I do not have stirrups. I do not have you scoot down towards me. Like it's very much, not like that. So.
Okay. Oh, if you don't mind, how does it look? Like what? Like if, for example, you would come to me. Like what do we do?
Yeah, sure. So I come to your house. Typically, we go sit wherever's comfortable at the dining room table, whatever, just to kind of go over your history. I have a pretty intensive, or like a lot of information is filled out on my intake form, so I kind of know what's going on. But then filling in the dots of that, and then typically we just use couch or bed, and we have a Chuck's pad, drape sheet. They get undressed from the waist down, and first starting really examining the abdomen and the musculature around the pelvis, because I mean that musculature plays a huge role in pelvic floor too, especially the fascia too, of all the pelvic musculature. If there's connective tissue restrictions in there, it can be causing crazy symptoms like UTI-like symptoms.
Yeah.
Any kind of pelvic pains as well. So assessing for all of the connective tissue and the muscles and diastasis. And then if they're open or want to do a pelvic exam, it's one finger intravaginally, and we're testing the pelvic floor muscle tone and
just
strength.
Do that thing
so it's basically, starting basically index finger vaginally, starting one knuckle, and we're testing for the tone. So ideally, a pelvic floor muscle, if you put your index and thumb together, it should feel soft and springy. And a tight pelvic floor muscle feels more like your thumb and pinky together. It's kind of hard.
Wait, this one?
Yeah. So it should feel like your index finger and thumb. Yeah.
Interesting.
And it shouldn't be painful. You should be able to touch it just like you touch anywhere else. So
can people check themselves? Yeah. Like, would that be possible, you think? Yeah. And then just kind of decide like, oh, maybe it's so painful. I need someone to help me.
Yeah. And I mean, we're not just working on pelvic floor. We're also working like why do you have this in the first place? Is it because you're always standing externally rotated, or are you always internally rotated, or do you have bad pressure mechanics, or are you not engaging when you need to? I mean, there's a lot of factors that can play into why you're having this tension in the first place. But yeah, there's things like pelvic wands that are kind of like little trigger point wands that you can use.
Like that, what do they always sell? Like that psoas hook?
Yeah, kind of like that, yeah.
Have you used that one?
I haven't used that one, no.
I don't know. I tried it.
It looks very traumatic.
Looks traumatic. And like my client bought it because his psoas is always so tight. It's like, oh, bought this.
But it's also like we should not be forcing, I'm always say like, my goal is not to cause pain. Like we need to meet the muscles where they're at. We can't push through them. We have to meet the muscles where they are. And I like to think like, it's like you have your finger on a stick of butter. Like your finger's soft, a stick of butter. You're like slowly waiting for the butter to melt.
Oh,
so that like slowly increasing pressure as the muscles relax.
Yeah. Oh, that's a beautiful analogy. Yeah. Love it. Yes, I actually 100% agree because I have clients who like torture me, like elbow me. I'm like, that's not what your muscle needs.
That's not what you need.
Yeah, exactly. Like she's gonna freak out on us. She doesn't want it. Yeah. Let her be.
But I also find that sometimes just working on the fascia, like I do a lot of cupping too, dynamic cupping where you have the silicone cups and you slide and glide them. Sometimes just releasing a lot of the fascia can automatically just help the muscles release as well. 100%. Increase blood flow. And I know, 100%. I remember you have a really good post about the fascia on your Instagram. You have a really great post about you have the knife and you jab it in the chicken.
Oh my God. Oh, that's the funniest thing. Actually, because I remember I told I kept telling my clients like, oh, your fascia is very like you have like
Yeah.
a tight fascia here.
Yeah.
Like, what is fascia?
I know.
I'm like, like raw chicken.
Yeah.
They're like, ew.
Yeah.
So it kind of like
Yeah.
became a joke, but that's the best analogy I
Yeah.
could come up with.
Well, I like saying it's like a full body cable knit leotard.
I like that.
And it's like a sweater. If you have a loose string and you pull it, it's going to cause pain or just any kind of weird symptom at a distant site. So
Yeah, absolutely. Yeah. No, fascia is fascinating. I'm so glad. I feel like there's also kind of like a trend on like, I feel like more and more people know what fascia is in general. And yeah, I remember first time I think I got really deep into it and like all the structures. It was like during quarantine because I had nothing to do. It was like like hiking and drinking coffee all day.
Yeah.
And I was just like, okay, I need to like research something. And I joined this really cool fascia research conference in Italy, like half broken translation subtitles, but it was like the most incredible thing. And since then I've been hooked. Yeah. And it's just like how everything's like interconnected and yeah, it's amazing.
Which I feel like in physical therapy school, they do not teach us enough about soft tissue work. We learn so much about joint mobilizations and manipulations and exercises, but like they kind of brush over the soft tissue aspect. I'm like, it's so important. And even some like students in my program are like, oh, we don't need to do that. It's just, I don't know, just making the patient feel good. Yeah, it's so bizarre.
I'm surprised.
But I think it's super important.
Or maybe I'm not surprised. I remember when I did massage school here, they pretty much did 3 weeks of anatomy and that was it.
Yeah.
And like how people didn't know where humor is was like by the end of it, I was like, you're going to be like touching people's muscles. Like you're supposed to know where they are.
Yeah.
I'm surprised that they don't because I feel like even like a lot of chiropractors, they like, focus very much on the joints and like all the adjustments. I have clients like, oh, I got the adjustment, it's all done. Like, but the soft tissues, if they're in a certain position, they're going to pull your joints back and you're just going to keep going, get adjusted.
And it's like, well, if you keep getting adjusted, you need to then do the exercises for your body to train to stay in that position. Like, or do your mobility exercises I mean, a lot of the times with manipulations, it's to gain more mobility in the hypomobile segments. It's like, well, now that they're more mobile, you need to do more mobility exercises to maintain that mobility so you don't have to go back for the rest of your life.
Absolutely. Yeah, absolutely. And yeah, that's pretty much how it works for me. Like if I visualize it, you work, on soft tissue, on the joints, you exercise to keep it all intact. Right. And then it's the matter of habit of your everyday life, of how you do things, like how you pick up things, how you like reach to grab something, and it's like what you're activating.
Yeah, that's the neuromotor re-ed. So like with the pelvic floor, we get the muscles all back down to the resting tone, and then we're doing that contract, relax, Kegel. Like, so once they're all relaxed, take that mental picture. What does it feel like right now? And then doing that contract, now we're going to drop back all the way down to where we just found everything. And then your homework is throughout the day, making sure you're not squeezed, drop. And I feel like that's one of the best things to help with the pelvic floor tension and pelvic pain stuff.
Right now, sorry.
Learning how to unclench your butt and unclench your pelvic floor throughout the day.
Yeah, bringing focus to it. Yeah, agree.
And then engaging it when you need it.
Yeah. Interesting. So tell me, I mean, we talk a lot about like kind of engaging and learning that connection. What in general, what is your opinion on all those like Parafit and all those like different,
like the Kegel trainers?
Yeah.
I mean, they can be good in some scenarios. I feel like just going to a pelvic PT once to know if you're doing a Kegel correctly, then maybe you don't even need to worry about washing, cleaning, inserting, finding the time. I mean, that just seems like a really big time commitment.
Yeah.
And like functionally, most people have symptoms in standing. So laying down and using this Kegel trainer might not necessarily help as much with your symptoms, especially if they're related to pressure management or during certain exercises. But yeah, and sometimes when people just have leaking with coughing, laughing, sneezing, we just need to, it's called the knack reflex, which is when the pelvic floor engages subconsciously when we have increases in abdominal pressure. So say when you jump, cough, laugh, sneeze, pelvic floor should turn on before that subconsciously so that you don't leak. So sometimes we lose that connection. So we do practice coughs where you inhale, everything relaxes, exhale, squeeze pelvic floor and cough. And that's your exercise to help retrain that reflex.
Interesting. I'm going to try that. Wait, hold on. So wait. Relax.
But you have to be able, after engaging, you need to be able to fully relax again, especially people who have more of the chronic pelvic pain conditions.
Yeah, I feel like I have a hard time relaxing like that area in general.
Most people do. I would say a majority of people have more excess tone than pure laxity.
Yeah. Interesting. Okay, cool. Because I have one of those tools, and I feel like, it's like a game thing. I don't know if you
Yeah, I know, I've seen it.
And I always ace it.
Yeah.
But then I'm like, something happens, like, well, I don't think my pelvic floor is strong
Yeah.
because this happened.
Well,
and
it
this
could
happened.
be that, yeah, it's stuck half engaged. You're squeezing or releasing, but not through the full range, potentially.
Okay, that's a good one. You see? Okay, cool. There's a question we had that how do you self-diagnose weak pelvic floor or prolapse? Because a lot of times, I mean, some of my clients told me that weirdly enough, when they have like first checkup after pregnancy, doctors don't check for that. I have like only like maybe a handful of people who got checked.
Right.
For
So, I mean,
pelvic
as a
floor.
pelvic floor therapist, I can check and see if I see any descent, but I'm not a medical doctor, so I can't stage the prolapse. That's just not within our scope.
Oh, okay.
But say here's the vaginal opening, we can press straight down and then have them kind of bear down like having a bowel movement and see if we see the urethra or bladder start to descend. And then we can press up and see if we see the rectum start to come out as well. But typically with a rectocele, which is the rectum prolapsing, you'll have trouble initiating bowel movements. You might have to splint. So put your finger intravaginally and press backwards because the rectum's kind of falling into the vaginal canal
I see. Yeah.
to be able to have the bowel movement. And then, I mean, typically you'll have those symptoms where you feel worse at the end of the day. You feel worse after prolonged standing. You feel better laying down. Symptoms are pretty non-existent right when you wake up. But then once you get up and walk around, they're worse kind of thing.
Oh, because again of like hyperactivation, they get worse as you
It's
kind of
more just with
active?
gravity.
Oh, okay. So pretty much you can self-diagnose it by having the symptoms, kind of.
Yeah.
Okay.
I wouldn't tell anyone to self-diagnose themselves, but
Okay. I mean, yeah. Always ask for help, for professional help. I mean, I agree.
Yeah.
I agree. Okay, cool. So I feel like we kind of talked about the bun clenching. I had that question on here as well.
I know I like the saying, relax your anus.
Try to relax your anus.
I feel like there in Russia there are a bunch of those little spiritual retreats about the anus and how it's pretty much rules the whole universe. So yeah, I like where you're going with this.
I hadn't heard that one.
I don't think I have awareness that much in my anus per se.
So with the pelvic floor, it should be everything.
Everything
From
together, right?
vaginal canal and rectum. All lift at once, relax at once. So some cues are like stopping the flow of urine, which I mean, I do not recommend stopping the flow of urine on the like. There's other ways to check your pelvic floor strength. You do not need to do that. Contribute to UTIs and whatever.
That might be a fun game.
So stopping the flow of urine, holding in a fart, basically, is another cue. Thinking like you have a marble in the vagina. So you're first that circumferential closure. So a lot of times with incontinence, we need that circumferential closure around the urethra. And then we have that pull up towards the head. So there's kind of like a two-part. Squeeze around in a circle, pull up. And then to relax, you drop the marble. So you squeeze around the marble, pull up towards your head, and inhale, drop.
You could pretty much do it just like by imagining, right? Kind of just like by...
Or think of it like an elevator. Yeah. It's like you're going up a floor and down.
Interesting. I like keep doing this. I'm like so
So
fascinated.
don't, I mean, but sometimes
Don't
when
do it
people
now.
do, but I mean, especially if they have pelvic pain or pelvic tension, like you can develop, I mean, not just everyone should just start doing Kegels all the time because you can get urinary frequency issues. I mean, typical urinary voiding schedule is every 2 to 4 hours. So sometimes when people do a bunch of Kegels, when they really don't need to be doing it, they can develop urgency, frequency. Maybe they can't make it to the bathroom on time. Maybe they leak urine on their way to the bathroom. That can be from a tight pelvic
you
floor.
telling me you can overdo Kegel? Like, really?
Well, especially if you're half engaged. If you just keep half engaging Kegels, you can make your tension a lot worse.
Oh, like if you're not doing it correctly and doing it frequently, you pretty much can make it worse. Oh,
Yeah.
That's... I feel like a lot of people do it because it's like a big trend.
Yeah.
But probably a lot of them also do not do it correctly.
Well, I mean, there's a lot of anti-Kegelers out there too. So I wouldn't say I'm an anti-Kegeler.
Is there like a
there's like a whole lot of PT clinics that are like no Kegel pelvic PT.
They use it
They
as a
promote
marketing?
that as which I feel like it's like a really, I mean, it's just like a whoa, who are they? You know, gain a lot of traction. I don't know. Which I mean, like I get the idea of like we can be doing these pelvic floor contractions with daily activities or more functionally than just laying on your back and doing pelvic floor contractions. But we do need to develop that awareness, and some people they're super helpful. So
Okay. Interesting. Wow, you guys have a lot going on there. A lot of drama.
Yeah,
Just
for
like
sure.
2 different camps.
Yeah.
Cool. Okay. Oh, so someone asked because they heard it from, I guess, someone, I don't know. They just said, I heard that pelvic floor and TMJ are related. Is that
For
true?
sure, yeah.
Really?
Yeah.
Wait, tell me more, because I know about hip flexors and TMJ and how a lot of times if you want to relax your jaw, you work on your hip flexors. How is pelvic floor tied into this?
So embryologically, they're made of the same tissue when we're in embryo.
Wait, pelvic floor
Muscles and TMJ. And if
Sorry.
you think about it, it's the opening and exit.
I guess.
Yeah.
That makes sense. Yes. Okay.
And there's fascia. There is a fascial line that goes from the jaw all the way down to the foot. And if you think about it, if you're clenching your jaw all night, you're going to be clenching your pelvic floor all night too. Just that tension. Clench your jaw and notice if you feel your pelvic floor clench. Mine does.
I feel like, yeah.
So sometimes if you're prone to pelvic floor tension during exercise, you can bring your tongue to the roof of your mouth, relax your jaw. And for people that do have the pelvic floor tension, you might not be able to do every rep. Say if you're going to an exercise class, so maybe you just do every other rep or every few reps and then practice your diaphragmatic breathing, make sure pelvic floor is relaxing all the way down before the next rep.
Wait, so with you by bringing your tongue to the roof of your mouth, you pretty much forces
the
your
jaw to relax and helps pelvic floor relax.
Interesting. Yeah. Okay. Oh wow. Okay, that's very cool. Wait, so do you kind of they have that hypertension in the pelvic floor? Would you go in the jaw and kind of?
We can do manual release in the jaw, so you'd have like index finger, internal thumb, external, and you can release some of these muscles in here.
And that would help pelvic floor.
Good.
Amazing. I love it. Okay.
Well, it can help in a way that now your jaw won't be clenched all the time, and now your pelvic floor won't be clenched all the time.
For sure. Yeah. I mean, I work a lot on the jaw because it can go into paralysis and just cause like a whole array of things in the CM and but I actually, funny enough, I do it when I work on hip flexors. If they it's too tight, I go in the jaw, work the jaw a little bit, and go back into hip flexors. I feel like it is looser. Yeah. It might be in my head, but I feel like it does work. Okay. Oh, and that was an interesting one for me too. And I guess we kind of also talked about it, tailbone and the pelvic floor for like those deep rotators. I feel like a lot of times, a lot of moms, they do have...
Yeah, the posterior pelvic floor gets tight.
Yes, exactly. And like that whole area, like I feel like it's painful to sit down and like that, tailbone is very painful.
Well, majority of the pelvic floor muscles attach directly to the tailbone.
Oh, okay. Yeah.
So if you think about the pelvic floor muscles, they go from the pubic bone to the tailbone and both sit bones. They're kind of like a little hammock or trampoline underneath.
So would you say at the attachment sides there, but like regular muscles, they also get more tight than in the belly?
What do you mean?
Like a lot of times, for example, if I go structurally in the muscle, they have more tension where the muscle attaches rather than like the thicker belly part of the muscle.
I don't know that I'd say that, but say like if the tailbone's deviated to one side, the muscles are likely going to be shortened and tight on the side it's deviated to and stretched and weak on the opposite side. Okay. So pelvic alignment is really important to have optimal pelvic floor function. Also postpartum, a lot of people get into sacral flexion, so their tailbone is kind of going backwards.
I noticed
so
that,
bringing the sacrum back into a more neutral position can really help with pelvic floor muscle recruitment as well. I see. Just so that the muscles aren't so stretched out, so they can have a better range to engage properly.
Do you work with your clients who are postpartum on that tailbone kind of sacrum?
So yeah, I do some adjustments too. I don't really do manipulations. If you need manipulation, I'll probably refer them to a chiropractor just because I don't love doing them. But I do like if they're laying on their back, have them bridge up, put my hand under their sacrum and kind of apply pressure up and pull down towards their feet. A lot of times that can really help with sciatica too.
100%. Yeah. I mean, it's a kind of like a soft tissue manipulation through, I do it for like a joint. I do that as well. Yeah. And that a lot of times to me seems like more therapeutic than going to kind of forcefully.
Right. No. And it's like we need the muscles and fascia to be released first before you, before you make something.
100%. Yeah, I agree.
Especially with like tailbone manipulations, it's like, well, we should probably get the tone of the pelvic floor muscles like really soft and springy before we try and mobilize the tailbone. Yeah.
So you would go to pelvic floor first and then maybe try to manipulate
so we can also, we do intravaginal and we can also do an interrectal treatment. So we can more directly access the tailbone rectally and can mobilize it.
I see. Interesting.
Yeah.
That's cool.
But that would be more for people that have a hyperflexed tailbone. So people that have had like a fall in their tailbone or pelvic floor muscles really tight. Sometimes it pulls their tailbone forward, and that can really contribute to the pelvic pain or tailbone pain. So we can get the muscles loose and then try to get the tailbone back into its natural position.
Okay. Interesting. Yeah, I feel like some of my clients had that kind of tilt, I guess you would say, in the tailbone after delivering like on a hospital bed or something, because they just like it wasn't properly
had nowhere to move.
Exactly. Yeah. So it just kind of like shifted the whole thing. Yeah. So I feel like they might need that pelvic floor and tailbone adjustment. Oh, have you heard? That's interesting. Have you heard about Botox injections for pelvic floor? Wait, are you telling me that's like a regular thing that people do?
So when I was working at Urology Austin, I saw more of that.
Okay.
So people that have more of the chronic pelvic floor tension, it can help relax the muscles.
Kind of similar when they do like the TMJ, just to freeze it and not have that joint very inflamed, like to masseter. Do you know they do like Botox to masseter as well?
Not so much. I'm learning from you now.
Well, that's how I know it. But when I heard that you can do Botox in your pelvic floor, I was like, I get the idea, but it just seems, first of all, probably insanely painful. But second of all, like, does it actually help?
It can help, especially if you're not responding well to the manual work. I've had some people when I was at Urology Austin try it. I mean, a lot of the times the more pregnancy postpartum population are more acute. So their tension's more acute, so it resolves easier. But some of these people that have had chronic pelvic pain for years and years and years, it's like, well, if you've had this for so long, it's going to take longer to treat. So sometimes doing those interventions can help in the beginning.
Help the symptoms of the pelvic floor tightness, but then you still have to work.
Still work with pelvic floor PT. But
that's what I thought. Yeah, because I feel like a lot of times the people who do at least I had one client like that in New York. She did a Botox injection in her masseter to help her TMJ, but then she's like, well, it doesn't hurt. I'm not going to do anything until next time. Right,
it's like, well, now, I mean, while it doesn't hurt, you should like work on maintaining.
Okay. So where you work, they pretty much did it as like kind of like just to help you with symptoms and pain.
Yeah, well, what was awesome about being there is that we could really easily work directly with the urologist within the same practice. So yeah.
Okay.
But I mean, I am more hesitant about the Botox injections in the bladder because you don't want to have your bladder.
Wait, they do that too?
They can do that too.
What for?
For people that have a lot of urgency frequency, like really severe, they're peeing every 15 minutes type thing.
Okay. And the freeze is just like the smooth muscles of the bladder and
the detrusor muscle, so it doesn't spasm as much.
Interesting.
But you also don't want to have urinary retention, so that's a risk.
Yeah.
Because if your bladder is like more stretched out, then you might not get to urge, and then that can contribute to infections and stuff too. So.
Wow.
Yeah.
And that also like the regular Botox, it lasts like a couple of months only, right?
Yeah.
I think. Yeah. Wow, bladder. I don't know. I cannot imagine. That seems very painful to me. I don't know probably what it.
I mean, the cystoscopies are pretty scary to watch.
Oh gosh. Okay, so we had a question also, one more from Instagram. So I pee when I sneeze, tight pelvic floor muscles, never pregnant. Any tips?
Yeah, I mean, so regaining that awareness of when you're relaxed. And then, so the first step is getting the muscles down to their normal tones. Sometimes your leaking will get worse before it gets better because if your pelvic floor muscles are tight, it's kind of a natural strength, if you want to call it, that's kind of half engaging. So you're still having that leakage, but sometimes once we get those muscles down, now they're fully relaxed and you don't have that strength build up yet. So your leakage might get a little worse. And then once you're able to find that neuromotor relax on command, relax, then we can work back up on that strengthening to be able to turn on when you need it, retrain that neck reflex, practice those pelvic floor contractions with your sneezing. Also working on your pressure management, making sure you're able to breathe through your posterior rib cage, working on serratus anterior. I like just going on hands and knees and kind of, it's not a cat-cow, but it's like a scapular retraction. Inhaling as you round the back, exhaling as you squeeze shoulder blades together.
Okay. My trainer who is in the somatic, she does like a lot of those scapular movements. So wait, when you do down kind of away from each other, you inhale?
So basically, as your back is rounding, you're inhaling to fill your back with air. So you're learning to breathe into your back.
Interesting.
Also, the posture. Make sure. I mean, sometimes also if you're leaking when you're sneezing when you cough, lean forward, stick your butt out. Sometimes that can help because
when you're standing.
So if you leak when you sneeze when you're standing, sometimes it can help to kind of stick your bottom back and lean forward. That way, your pubic bones are supporting your bladder better.
Oh, that's a cool
Yeah.
tip, I guess.
But then still
Yeah.
retraining that neck reflex, working on pressure management, making sure you're breathing through your back, making sure you're not flaring your ribs open all the time, finding your
So
stack.
all, like, I don't know if they said it here, but everyone in not everyone, gosh, the women in Russia is like, oh, when you like go on the street, like get your chest out so everyone can see a beautiful
Which I
breast
mean,
and
we
your butt out.
we want the chest out, but we also want the ribs down because a lot of people get stuck in the rib flare with the chest out. So we want the chest open but ribs down. It's really hard to train yourself to do
Yeah,
that.
it sounds very hard. It's like do this, but then this and this and you see, apparently ballerinas don't have a good pelvic floor, so think about it twice when someone tells you should have a posture like ballerina. Okay, and then there's one more question. Why do I feel sharp pain in my anus sometimes?
Yeah, so that's a real thing. Sometimes you'll have that sharp shooting. It could be like an 8, 9 out of 10 pain just shooting up your rectum, right? So typically that's tight pelvic floor muscles spasming.
Oh,
Yeah.
What causes the spasm? Just like kind of like the positioning,
Typically,
tiredness.
just
like
like
we're
me,
so tired.
personal thing. I used to get hip flexor spasms from like when I was in PT school from sitting all of the time.
Wait, how does that feel?
So basically, I would be sitting down fine. After studying, I'd stand up and have 9 out of 10 shooting pain for like a couple seconds in my hip flexor.
Oh, wow.
Yeah. So, that was all just
I
like...
don't think I have gotten that kind of like spasm in that area.
Muscles can just kind of spasm at random times,
Yeah.
honestly, when they're tight and irritated.
What did you do for
to
just
fix,
like stop the school
to fix mine? Well, I did
drop out.
I did a lot of cupping on my thighs and inner thighs, and then I find that sometimes tight muscles, like I said, I think before, can't release until you do that fascial release. So I would do a lot of cupping and skin rolling on my thighs.
Yeah.
And then I just kind of worked on my hip flexor strengthening. I'd lay on my back after I like to do your myofascial release your muscles, maybe foam roll, whatever you like to do. And then once your muscles are loose, retrain that range of motion. So just like the pelvic floor, get the muscles relaxed, retrain that range.
Yeah.
With the hip flexors, same thing. I feel like it's the same with most all muscle groups.
So if that sharp pain, like 9 out of 10, as you said, is spasm. So is there anything you can do in a moment to ease it up? Like, if it sounds like a very painful thing.
I feel like not really.
Not really.
Not really in the moment.
Okay. Just book that appointment. You're like, you're getting
like,
the spasm. You're like, okay, I have to text Krista.
Sharp rectal pains. They usually are pretty random. And it's just the muscles kind of going, okay, pay attention. Like something's not right here.
Yeah. Pain is usually as indicators, like your body's trying to communicate with you. But I feel like a lot of times we just like numb it and
or also like
go about a day.
Painful periods. Like periods should not make you stop having to go to school or work or be able to participate in your daily activities.
Wait, really? Because I feel like that's such a common. I thankfully I have like the most amazing period. Thank God. I'm like so blessed. Yeah. But I know I had like a coworker in New York. She like literally had to take like 4 days off work because she like almost got to go to the hospital every time.
Yeah, that's not normal.
So it could be caused for pelvic.
So I see a lot of people for painful periods too. So a lot of times it's fascial restrictions over the abdomen, and pelvic floor muscle tension as well. Also, some people do have endometriosis. The only real way to know is to do the laparoscopic surgery, which is not everyone wants to do that to find out if that's the reason. A lot of times the symptoms are masked by going on birth control, but that's not kind of treating the problem. Yeah. A lot of times it can be diet. Trying to do anti-inflammatory diets, because inflammation definitely plays a role. Yeah. And then when there is fibroids or endometriosis, or if you've just had recurrent UTIs, the muscles and fascia get tensed and guarded. So we need to get everything soft, smooth, slide and glide it like it needs to, and get everything back into its normal range. So like with people with endometriosis, we can't make their endometriosis go away as a PT, but we can help manage the symptoms.
Wow.
Yeah. Wow. Also, you can use the electrical stimulation. If you've heard of TENS, have you heard of that? Like people use it during labor sometimes for pain relief on their back.
I don't think so.
It's
like electrodes?
Electrical stimulation, electrodes. So during periods, you can use that on your abdomen or your low back too. And it's kind of like a mental distraction type thing to help decrease pain.
So you feel it tinkling somewhere else, so you're like distracted from what's going on.
Your body can only focus on one thing at once.
I like it. Yeah, it's like I always remember when we talk about something like that. I know there's like this old movie, Mayor Payne or something like that.
I don't know.
Have you seen it? Okay, so he's like in the war setting, and this guy he like lost his leg or something. He's like, I'm gonna help you with the pain, and he just breaks his finger on a spot. He's like, it hurts. Like, you don't think about your leg anymore.
Know. Yep.
So very much, the same idea. So electrodes is a good idea if you're having that against that.
Yeah, it's called
pain.
TENS.
TENS?
Transcutaneous electrical stimulation.
Oh gosh, I don't think I can pronounce that.
TENS.
My English is not that good.
TENS.
TENS. Okay, I just call them electrodes. I don't know.
Yeah.
They just remind me, like those commercials for ab training back in the day. They like stick the.
It's the same thing, pretty much.
Yeah, pretty much. Yeah,
it's just different parameters for different things.
Okay, and different marketing too.
Yeah. No, but some of these, like, you can get a e-stim unit for like $30. And the more expensive does not mean the more better. It just means that they have these fancy names that make it sound special.
Oh, really?
Yeah.
Okay, so the $80, $100 is not.
Yeah, the
really
one I
worth
have
it.
is $30. Yeah.
There you go. Where's it? Just buy it on Amazon.
Amazon, yeah.
Yeah. Okay.
Yeah. And no, the cheap ones are better because they have little knobs that you can turn up and down. The other ones you have to click these buttons.
Oh.
Yeah.
Okay, that sounds actually. Yeah, that
so
sounds
like
easier.
for during labor, you can twist the knob during a contraction, make it more intense, then turn it back down when the contraction stops.
Nice. I don't know if I'm gonna ask if any of my clients use it during labor. Yeah. So we have pre-pregnancy, we have pregnancy and postpartum. If you had to choose, which one would you choose to train your pelvic floor in?
Before I get pregnant, for sure.
Before?
Yeah.
Not during or after? I mean, if you had to choose.
Well, I feel like maybe during pregnancy.
Okay, you change the answer.
Well, I mean...
Wait, let me
If I
ask
had
one more
to pick
time and then
one-
you choose after.
Well, you said if I had to pick one.
Yes, if you had to pick
So,
one.
like, I can't do any of the others. I can only do one.
Yes.
I would do during pregnancy.
Okay, but otherwise you would do all of them, obviously.
Yeah.
Okay, so wait, what was the last answer before or
I
during?
said before pregnancy.
Before
Or,
pregnancy.
Yeah, like before conception, yeah.
Okay, so kind of train your pelvic floor, make sure you know how to operate or have that connection, then go into pregnancy.
But why I changed my answer is because during pregnancy, you can lose that connection and have to
what
try.
causes you to lose that connection?
Just
all the
different
stretching.
stretching and weight changes and posture changes.
So your body's like, okay, there's too much happening.
Yeah.
We need to disconnect so I can.
No, like I've seen some clients that are super strong and like great athletes before pregnancy, and then during pregnancy, like it's like, wait, where'd all your strength go?
you tell them that.
No. Well, sometimes like the core and deep core strength, it's just like the coordination. I wouldn't say it's super lost, but it's just that coordination or that mind body connection is confused.
Yeah, for sure.
And like they can gain it back pretty fast. But yeah.
Okay. All right. But if you had that initial training and awareness, I guess it's easier for you maybe to get back into it afterwards or during, right?
Yeah. Well, and I mean, during pregnancy, we can prevent a lot of things, like help prevent tearing, help prevent diastasis, help prevent prolapse, just the weight of the pregnancy can play a huge toll on your body. I mean, sometimes people who have C-sections think, oh, like, I didn't have a vaginal birth, I don't need pelvic PT, but it's like, you still carried your baby the whole term. Like,
Yes. Yeah.
your pelvic floor was still definitely affected.
Plus, I feel like, I work a lot with the kind of post C-section to help to free that uterus of all the like scar tissue because it's still cut through 7 layers. And
and the ab rehab, I mean, you have to relearn how to use your core.
Absolutely. And again, like that fascia, it's all like sticky and
can contribute to
tight and-
constipation, painful periods, painful bowel movements.
and pull on, I'm
Painful
sure,
urination.
like pelvic floor and all those like structures anyway. So yeah, I would assume there should be like a protocol now, healthcare in general, to have, if you had a C-section, or if you had a baby in general, obviously.
Should be standard of care.
Right, exactly.
Well,
I'm
like,
like,
it is in France and other
is?
countries, yeah.
Wait, like a pelvic floor?
Postpartum pelvic PT. Yeah.
Okay, nice. It's not here yet.
No.
Are they pushing for it? Is anyone doing anything in that direction?
I mean, insurance is, I'll say.
Yeah, okay. We're not going to open that can of worms. But yeah, absolutely. So I feel like if you had baby, obviously, I know you're going for the second one. If you had a C-section, especially, I feel like any of that kind of work, just helping that uterus, the abdominals, the pelvic floor is going to do so much good for your second pregnancy.
Yeah.
Yeah, and prevent a lot of those things. But you said you help, for example, prevent tearing. So is that also by having that connection?
Yeah, so I would say the 3 main ways to prevent tearing are having that mind-body connection, knowing when you're engaged, knowing when you're relaxed. When you're pushing, it's kind of like having a big bowel movement. You need to know how to do that kind of bear down stretch of the muscles. A muscle that is engaged is much more likely to tear when it's on stretch. And then doing
so all the myths about like, oh, it's just a big baby.
Yeah.
It's kind of goes out the window. You're
like
no.
your body was meant to do this. Like, do not let your doctor tell you your baby's head's too big.
Okay.
Also, like ultrasounds do not have very, I mean, they can be off.
I heard it's
by-
like pound off.
I think like by
plus
2
min-
pounds, plus or minus
By
2
two?
pounds or
Oh my
something.
gosh. Yeah.
Yeah. So it's like, take that with a grain of salt, you know. I don't know. Don't let people tell you your baby belly's too big, too small. Like, yeah.
Yeah, everyone care is different too. I feel like it's such a different, even I always raise that question when I have like those pregnancy pillows, and you don't use them, right? Because you guys usually are on the couch, but like for face down position. And I always argue like, oh, you should have like those that adjust, because everyone's like torso could be shorter, could be longer. Like it's everyone's belly is so different by the shape, by the look.
Right.
So it's weird when we try to kind of put it as like under one model, I guess. Yeah.
right.
So definitely when someone tells you something is wrong with you probably shouldn't listen to them.
But the other 2 ways. So first way to prevent tearing is being able to relax on command. Second way is doing that perineal prep. So the trigger point release of the pelvic floor muscles plus kind of the sweeping and stretching motions. And number 3 is practicing getting in. So this is what we do during our labor prep session. We get into all the different birthing positions and we practice that bear down position, or that bear down relaxation, whatever you want to call it, and find which position they're able to do that best in.
Is it different for everyone?
Yeah,
Really?
individualized. Which, I mean, you might feel different during actual labor and pick a different position, but it can give you like your top 3 best positions.
Okay.
Yeah.
That's interesting.
Like some people think that birthing in a squat is going to be the best position, but in today's society, when do we ever really squat? A lot of people can't really fully relax in a deep squat. Some people can because they do deep squats all the time, but very individualized.
So if you kind of like your body hasn't been doing that for
I mean,
years,
like in other cultures, they eat in a squat. They use the bathroom in a squat. They're like in a squat all the time, and that's a relaxation pose for them. Whereas for us, I feel like most people are more like, this is a engagement, I'm working position.
100%. Yeah. I've noticed that a lot of people, it's also because the ankles, they have very immobile ankles, and so it's the deep squat is actually very
it's a hard position to hold.
Exactly. Yeah. So it
So
might
unless
be not
you
the
feel
most
like you can like
relaxing.
sleep in that position, I don't know.
Wait, I'm sleeping on my
No,
stomach,
I don't
so
think
maybe
anyone
I
could
should
sleep.
give
I don't
birth
think
on my-
anyone could sleep in a deep spot.
I don't know. We have like those I guess people in Russia and Asia they use deep squat for a bunch of things, like sometimes working, having conversations with your friends. So I feel like they could.
yeah. No, it's definitely individualized.
Yeah. Okay. So what would you say? I guess for America would be the pose. To have a
I mean,
baby.
a lot of people do well on like their forearms and knees with their
like on the fourth.
on forearms.
Oh, on the forearms,
And knees. And then, so during first stage of labor is when we're trying to get baby to come down into the pelvis. So that's when deep squats can be great to help everything come down. And then kind of that mid stage is more when you can do more asymmetrical positions, like maybe doing like stair walking. You have one foot on a stair and you're kind of walking asymmetrically, or put one foot up on a box or step and rock back and forth. And then during pushing, it's good to have that internal hip rotation. So knees together, feet out, because that helps widen the sit bones to make more room for baby's head. So some people really like to be on their forearms and knees with their feet a little bit wider than their knees, or on their side with like a peanut ball, so their knees can be a little bit wider than their knees too. But
Interesting.
very individualized wherever.
Yeah. Cool.
We'll check and see which ones they have the most awareness in, and then whichever ones are like the ones they prefer.
Yeah, I think that's actually very helpful to know what the position your body kind of be
or
more
just to make sure
to,
you know how to do that bulge down.
Yeah, I
sensation
agree. I had no idea you can use pelvic floor specialist in that sense.
Yeah.
Like actually learn about your body for
Right,
such a
right.
great event in
Well,
your
I mean,
life.
I see a lot of people for constipation too. So like we do a lot of learning how to bulge down for bowel movements too. Like there are things, just like you can get vaginal dilators to gain confidence before going back to sex or things like that. You can also use rectal dilators, which I should pull one out. They have like a little bulge in the middle, and you insert it rectally, and it feels like you have stool, and then you practice the core, like the abdominal contraction while releasing the pelvic floor muscles to regain that coordination. Because sometimes constipation, you could be eating, right? You could be drinking enough water, and it's more what we call functional constipation, which is when the muscles lose their coordination, and we have to retrain them how to expel stool, and that's when you can use the rectal dilator.
Wow.
Yeah.
Well, you do it for just for anyone who has the issue with that, or is specific for like pregnancy?
No,
postpartum?
that would not necessarily be pregnancy postpartum.
Got
That's
it. Got it. Just
pelvic
someone
health
has
in
the
general.
Interesting. Oh wow.
Which, I mean, could be someone postpartum. I mean, that's why I like working with pregnancy postpartum, because you can still see like a wide variation of things.
Yeah, I actually agree on that. It makes your job more interesting. You're like, I like going to clients who have something wrong. I'm like, oh, it's gonna be so much fun to fix this and see what's going on. Play detective a little bit.
Yeah.
Okay, cool. Yeah, we've been recording an hour, but it doesn't feel like it. It's been such a actually smooth, I feel like, conversation. I hope we got something good on there. But Sanchi,
Yum yum yum.
yeah, the tea's not bad actually.
Do you have a YouTube?
This is gonna be the YouTube.
Oh, okay.
Do you have?
I have a YouTube. Yeah, I mean, I don't. That's where I post all like my home exercise program videos.
Ooh, how cool.
Yeah, so maybe they have to subscribe to my YouTube.
Let's do that. Yeah. So Dr. Krista has a gift for all our listeners and watchers. And do we know what it is?
So it's going to be kind of just some great pelvic health tips that I feel like everyone can kind of put into their daily life that, I mean, are things that I try to do every day. And I mean, things that aren't necessarily individualized for a treatment of any condition, but more just what are good habits to promote pelvic health in general.
Absolutely. Awesome. I mean, I would want one of those. So if you want one of those, document, I guess, with all the tips from Dr. Krista, we're just going to ask you to subscribe to this channel and to Dr. Krista's channel, which reports a bunch of really cool exercises for pelvic floor health and other, I guess, all the connections that we talked about. So just subscribe and DM us a word pelvis. DM us a word pelvis, and we're gonna send you one. And we hope you loved it. Thank you so much, Krista, for joining. And it's our first episode. I'm so excited it was with you. Yay! Woo!
Thank you.